If you're feeling like a lump on a log, or meaner than a junkyard dog, you've got questions, well I do too. Come on and join the solution revolution. There's answers for me and you. Yeah, there's answers that we can use. Come on and join the solution revolution.
Hi again, everybody. Welcome back to Mender Online. I'm Leo Battenhausen, and I'm glad to be back. Today is Sunday, April 17th, 2016, and I hope you had a great week. I want to thank a lot of you for your support for Mender so far. It's only been a few weeks, and we're getting a lot of likes and people subscribing to the YouTube site, and the Facebook site, Mender, is also doing extremely well. So thank you to all of you and all of my friends who are making this solution revolution a reality. And we're only at the beginning. We've got a lot of stuff to cover. So if you are liking what you see and want to join that solution revolution, please click the like button on YouTube and on Facebook for Mender, and also subscribe to the YouTube site as well. That would be awesome, and you'll get notifications whenever a new video pops up. As promised last time we were on, I wanted to talk a little more today, a little bit about depression, and also about how to pick yourself the right therapist. This is a really important part of treatment, your therapist, and when it comes to depression. But first I want to talk about a study I've just found. Actually, there's numerous empirical studies that, if you remember when I spoke at the last presentation about, a fictitious depression, but not necessarily fictitious, but one that doesn't require antidepressants and this sort of thing. Sometimes we just feel we're stuck somewhere, and we instead of running to our general doctor, our primary doctors to get an antidepressant, there's hundreds of empirical studies that have showed that psychotherapy is actually cheaper than antidepressants and works a heck of a lot better for many cases of depression. This is fantastic news. You think the pharmaceutical companies would want you to know that, but they don't, of course. They want to make their money, and insurance companies want to keep people out of psychotherapist's office and onto the pills. So I guess they're all in cahoots at some form or another, because they don't want to pay psychotherapists for therapy. Instead, they want to pay for pills, which makes no sense to me, but neither do big corporations like that, who don't care about people's well-being. They care about making money. But anyway, I'm looking at studies here. The estimates that from these empirical studies say that the psychotherapy works 75 to 80% of the time in depression. Those are astronomical figures. But, and it's a big but, the question is, what makes a good psychotherapist? Okay, and that brings me to today's topic. How do you find the right psychotherapist, and what do you need to look for to avoid with a psychotherapist? Now, I am a Carl Rogers follower. Carl Rogers was one of the first, or one of the founding fathers of what they call humanistic therapy, the humanistic approach. And that is where the client, the treatment is client-centered, and it's established on the grounds of trust and genuineness on the therapist's part. Those are the two key important factors in finding the right therapist. Genuineness and trust. Those two things must be established in order for psychotherapy to work, according to Rogers and according to me. Okay, now some people are still resistant to looking for a therapist. They're still maybe of the old school where they say, I don't need somebody to tell me what to do, or I don't want to share my personal business with a stranger. And some families will keep other family members away from, disclosing the family secrets, this sort of thing. And those are all still lingering today, these blockades to therapy services. Also, the media has not done a very good job in depicting, what psychotherapy is all about. For the most part, they show psychotherapists as very stone-faced, feelingless suits sitting there, with a pad and a pencil, just going, well, tell me how you feel. Tell me more. We call them Dr. Uh-huhs in my field, and that's not good psychotherapy either. Of course, that's where it came from. Years and years ago, that was psychotherapy, where the client laid on the couch and the therapist sat with his back to the client taking notes, which is very odd. I wonder what they're writing on those sheets, maybe the grocery list for the ride home, but it certainly doesn't seem like that would be effective treatment today. But some people still have that stereotype, and they think therapists are a bunch of whackpots. But you know what? There are a lot of whackpots in this field, and they come into this field for various reasons. Most of us have come into this field because of something in our past that, has affected us, and we maybe overcome it, or maybe want to learn more about it and overcome it then and help other people. Some of us just go into this field because we want to help other people. But some people come into this field to fix their own problems without ever getting over their past problems or working through their past problems. These folks are very dangerous, I would say, to the field, and they do exist. So if somebody actually has the courage to find a therapist for the first time and makes that appointment and goes and has a really bad experience, one of two things is going to happen. They're either going to never come back and say they're all a bunch of whackpots and I'm never going back to therapy. That's one option. And the other option is they think that is what therapy is all about. So no matter how much of a whackpot they have wound up with, they keep going, and because they think that's what it's all about. But I'm here to tell you that that's not what it's all about. And, we need sometimes to shop around for the right fit, so to speak. A therapist is more than just, anybody you find in a phone book. You have to make a connection with that person based on trust and genuineness, like Carl Rogers said. And that, that encompasses a lot of skills and interpersonal skills and communication skills and kindness and interest and devotion from the therapist that makes you feel comfortable. Now, there's not a time I've seen a client for the first time that I don't ask them at the end of their session, do you feel comfortable talking to me? Because that's really important. No one's ever said they didn't, which I'm glad and thankful for that. But that's a question that should be asked. And if you are one that goes to a first appointment and are not asked that, you should at least ask yourself that. And if you're not comfortable, you need to go on and move on and look for another therapist that suits your needs and is a good match for your personality, because this is the most important part of treatment. Even if you are on antidepressants or any kind of medication, the therapist and you put the work together to get you through it. Medication, to me, is no more than 30% of the solution. The rest is work on your own and work with your therapist. So you can't trust a whackpot with issues that are so important and that are affecting your life, that brought you to therapy to begin with. There's another type of therapist that I call the Ivy League therapist. These are people that have gone, they've lived a gilded life, grew up with lots of money, and went to very prestigious Ivy League schools and earned their PhD in psychology. And upon graduation, they open up an office in a very nice, posh office building. And here I am, I'm a psychotherapist. So you might go to that therapist and say, this is very nice. Oh, look at this place. This must be a good therapist. But that's just perception, and it's not reality. Because sometimes, you have a very nice degree and a beautiful office setup, but you have no experience. And these people, for the most part, have not worked in the trenches of mental health care, and learned from anything other than the books they've studied in college. which is all well and good. But I'll tell you honestly, I don't rely on book knowledge for any more than 10% of my work right now. That's right. So I don't, it's not about where you went to school, folks. It's about what you've done to get where you are. And I have worked in jails, state psychiatric hospitals, alcohol and drug clinics and rehabs, mental health programs, employee assistance programs. I've managed things. I've developed programs. I've directed programs. I've done a lot to get to the position I'm in now of private practice. And that, to me, this position I'm in now should be earned. It should not be something you just graduate college with your high and mighty degree and start thinking you can be a help to people. Because, no matter how much education I have or another person has, my belief is the true education that's going to help other people in therapy comes from you or our clients. I have learned more about my field and what I do from my clients than from any class or book I've ever read or any theory I've ever studied. It's the bottom line. And that's true in a lot of careers, but especially in psychotherapy. If you want to be bored to death by psychobabble, and what this theory means and what that theory means, then by all means, go to one of those types of expensive, well-dressed, well-suited psychotherapists, because that's mostly what they're going to give you without any real-life experience. But you really should be seeking out someone like you or me that is a regular person and truly cares for your well-being, and you can relate to your struggles and what you need from therapy. Okay? Now, I've heard other stories that have curled my hair as a therapist. I've heard horror stories about what some of my clients have experienced with other therapy experiences, to say it over again. And it's not pretty. It makes me wonder how these people, first of all, stay in business, and second of all, how many people continue to go to them and why. A couple of examples are, I've heard stories of therapists answering the phone while they're in session with a client. That doesn't instill genuineness or trust to me very much, okay? Other stories I've heard of therapists or psychiatrists even eating their lunch during a session. Am I that important that your sandwich takes precedence over my feeling suicidal? Not a good choice, but this stuff happens. Some therapists, and here's a sign for you to watch for, they speak too much about themselves. Whose therapy is this? They'll talk and talk and talk about themselves, or, oh, me too, I hate when that happens. That's not appropriate. It's not ethical, and it's unprofessional. You are not there to therapize, it's not a word, but provide therapy for your therapist. So they need to focus on you. You are there, and they are there to listen to you. Okay, but that's another story I've heard, talking about themselves all the time. Another thing is they don't respond to your calls in a timely manner. We do get busy sometimes, but 24 hours is the limit. If you're not hearing back from your therapist within 24 hours, that's a sign of irresponsibility, in my opinion, and it doesn't make you feel important, or doesn't instill the trust you need to make therapy work. And finally, some therapists I've heard cross a lot of boundaries. And what do I mean by boundaries? Well, I mean flirting with their clients, disclosing too much personal information, seeking sympathy or empathy from their clients. Those are professional boundaries that need not be crossed. And if you're seeing any of those, that's not the person you want to go get help from, okay? So those are just some horror stories there of what to avoid. But you want someone who makes you feel welcome, makes you feel like you're the only person they've seen that day. They're awake they're alert, they're in tune to you, and they're understanding you. And a good therapist should be able to speak in your language, whatever language that may be. I don't mean Spanish or Italian, but I mean the way you speak is the way they should speak to you, not over you or be condescending or in any way make you feel judged or less than them, is what I'm saying. You want a humanistic approach, folks. That means client-centered, okay? Someone who sees you with a genuine smile and genuinely is on board with you to get you through the troubles you're going through, and who's understandable, who explains to you in human language what's going on in their opinion and what they're going to do to try to help you and how you can help yourself. Therapists are not there to tell you what to do. That should never be. Therapists believe, at least humanistic therapists like myself believe, that our clients have the answers they need. They just need us to help them loosen the knots that are holding them back and unlock the locks that are holding back their power and their empowerment to solve the problems they have and are seeking help for. So those are generally the traits you want. A sense of humor certainly is important as well. You know, if your therapist is not one to have a sense of humor, and that can make for a long session as well. But these are my opinions, and this is what I think are important to make therapy effective. And that relationship you establish is probably one of the most important you can ever establish. And it should be a privilege to the therapist that you have chosen him or her, to allow them into your world and to help you get through the things that are troubling you. That's about trust. That's what Carl Rogers talked about. Trusting the integrity, the knowledge, and the care of a therapist with your problems, okay? It's not an easy decision sometimes to make, folks. We know that. The phone call and making that first step is very difficult. But when you do make it, you want to feel like there's hope. And this person should instill that hope in you and in a genuine way. Not an way, or strangle you with psychobabble that makes absolutely no sense to you. If I go to a doctor because my arm hurts, I don't care what the name of the vein is or the muscle that's twisting around or causing the pain. I want to know what it is. How do I fix it? What do I need to do to get better, doctor? I don't really care about the book analysis of exactly what's making the pain. I want to know how to fix it. And that's true with psychotherapy as well, in the most case. Okay, we want to know how to get better, and you want to be on board with a therapist who is on board and who you can trust to steer that ship through the rough waters you're going. So remember, you have choices. You're not stuck with any one therapist if you're not comfortable with that person. You can search for the right match. It's imperative. How do you find a therapist? Ideally, you will have a friend or a family member that knows of a therapist that helped them. Okay, that's usually the best way, is by referral. Most of my clients today are referred by other clients of mine, which is the highest honor I can expect as a therapist. But some people might not want to ask their friends or family about a therapist. They want to keep it private. That's fine too. Picking up a phone book and looking for anybody is to go to psychologytoday.com. Go to psychologytoday.com, and you can privately click on the search provider option and privately enter your zip code. It'll give you a list of people in your area, and you'll get to see their picture, read a little bit about their approach to therapy, because it's their self-biography, and get a feel for where they're coming from. And hopefully what they are advertising as who they are will be what they're also really about. Genuineness, okay, folks? Genuineness and trust. Remember those two things. And if you get them on the phone to make that appointment, please do not be afraid to ask questions. Questions such as, where have you worked before? What are some of your specialties? What is your approach to therapy? These are more important to me than what school did you attend. Trust me. Experience and how they come across on the phone as a person and their dedication to helping is much more important than how much they spent on their college education. I don't care if you went to Joe Blow's Community College or if you went to, Harvard. I want to know what kind of person you are. And are you going to be able to help me? And can I trust you? Are you really genuine in wanting to help me? So I hope these have been helpful for you. These are my guidelines. The horror stories I told you are true. You may know some of them already, or you may know of people that have gone through that already. Not a good experience and doesn't give therapy a good name. But if you listen and follow the suggestions I've made, I think you'll have a much more positive and better experience, in searching for a therapist and getting through what's causing you to be stuck. Again, thank you for helping get Mender up and running. If you like this video, please click the like button at the bottom and subscribe. Online.com, mindbenderonline.com, and on Facebook at Mender. Thank you. My name's Leo Battenhausen. Have a great week, and I'll see you again next time on Mender, the Solution Revolution. Take care.